Hey y'all, it's Kosta. I help people break the system to build a better future. Today we're talking about fixing the quality of senior care in nursing homes. There's a stigma about what life inside of a nursing home looks like. Residents of nursing homes across America complain about the number of resources, caregivers, and other drawbacks of staying at a nursing care facility. On the flip side, caregivers and other staff complain about high workloads at a taxing job. It's not an easy fix, and when the company running the facility is trying to squeeze out every last cent of profit, it has left many residents in unacceptable living conditions and caregivers in unfair workplaces. But it doesn't have to be that way. In 1987, Congress enacted the Nursing Home Reform Act. This bill was in response to a greatly unregulated industry and the number of complaints regarding mistreatment and resident health. In this act, some key rights were granted, such as the freedom from abuse, mistreatment, and neglect, freedom from physical restraints, and the right to manage one's own finances. More recently, the Biden administration reviewed conditions of nursing home facilities across the United States and found conditions to be especially bad during the pandemic. The official White House website outlines some key areas of concerns. Private equity ownership increased excess mortality for residents by 10%, increased prescriptions of antipsychotic drugs for residents by 50%, and overall, 82% of inspected nursing homes had a deficiency in infection prevention. In response, the federal government rolled out a plan this past February. These reforms would set a required ratio between staff and residents to keep up with the workload, hold nursing homes that subject residents to poor or unsafe environments accountable, and withhold their federal funding. Lastly, create more transparent forums for individuals to make educated decisions before choosing the home that is right for them. Though some of this plan can be achieved through regulation, much of it will have to go before the legislature to have enforcement. In theory, if all of these new reforms are enacted, it will push nursing homes to hire more staff, reduce workload, and promote competition. But without proper enforcement mechanisms, could only add to astronomical nursing home costs. Do you think these reforms are the right step towards better senior care standards? Let me know in the comments section below.